Hello everyone, thanks for joining us for the Superintendent's Report. I'm Carol Birdsong, and joining me for our discussion is Superintendent Jason Golden. And we are going to spend this time a little bit different than we normally do with our Superintendent's Report, but we're going to focus just on health and wellness as we plan for our return to school on Friday, August 6th for a half day. So, Superintendent Golden, let's talk about where we were. I guess we need to look back first at where we've been really over the past year, year and a half, year and a quarter, and then where we're headed.
Well, first, we are starting school on Friday, and one of the focus points we're talking about with our staff is academics and instruction. This year is going to have all the full accountability measures we've always had up until last year, what folks are calling the COVID year. So instruction is incredibly important, but we're spending most of the time today, as you mentioned, talking about our health protocols. And looking back, we know that really it's been a year and a half, 2 school years ago, where the governor said, you know what, everybody needs to close down schools for that last quarter of the spring. We did that. That happened statewide. Last year, we were in some very heavy protocols related to COVID, and we required masks. We very clearly required masks, and that requirement extended through the entire school year. We learned a lot over the course of that time, and we were able to really drill down to classrooms and to individual students and to individual staff members in implementing our COVID protocols. We started the very beginning of the year with a focus based on some community-wide numbers. We tried some metrics that said if the community numbers get to blank point, we will do blank at our schools.
That was actually technically our reopening plan, if you will. It wasn't necessarily something that we as a district intended to watch throughout the year. However, I think some of our community members did continue to watch that.
Well, that's right. Back at that point, we didn't know a whole lot about the virus, so we created a reopening plan, and we really searched hard for some metrics. We actually asked the state. We tried to see if there were any federal metrics. We developed metrics based on our community and what our community needed. And we learned very quickly, within a few weeks of school, that we could take those metrics and apply things even deeper into individual schools to try to keep students on campus if we could safely do so.
Also quarantine, that evolved over the past year as well, and how we operated.
The health department was quarantining a lot last year, and I'm talking about the state health department. They had regional help, and then the local health department was doing that as well. That had a big impact on us. And of course, all this was pre-vaccine, where they were going through that process of close contacts with quarantine. There's been some evolution on that. The quarantine is not as aggressive anymore because of the vaccine.
And we'll get into that a little bit later as we continue our discussion. But you brought up the vaccine, and so that we were able to hold our own clinics for staff. I guess it was March. During the month of March.
That's right. In the spring, we were able to administer vaccines to our faculty and staff members who chose it. We actually administered over 2,500 times 2 vaccines, because we did have the Pfizer vaccine, if I remember right. Moderna. Well, one of the two.
You're making me question what vaccine I got, but yes.
But in any event, we were able to give over 2,500 vaccines to our faculty and staff back in the spring. So we knew that made a big difference for us, really, in those last few weeks of school.
As you mentioned, we had strict protocols in place. As we approached the end of the school year, though, and went into summer school, we evolved as well.
Well, we required masks the entire school year, and the CDC language at the time actually recommended that schools require masks. And that was a big factor in our requiring masks. As we finished school, we knew we were doing a summer program, a summer school program with the state. We didn't have as many students on campus. We knew we were going to be doing some summer programs, not as many on campus. And we knew then that under the CDC protocols at that time, us finishing school for the year really eliminated that requirement. So when we transitioned to the summer, we did not require masks. We really didn't address it specifically at all. We didn't say we encourage masks, we just said we're not requiring masks, and we went through that summer school program. One of the great things about that is we didn't have any positive cases in our summer school over the course of that 4-week program. And so we learned a little bit from that. It was generally the younger children. It was kindergarten, rising first graders, through 8th grade, through middle school. We didn't have any high school programs there.
Okay. However, though, high school programs have continued because we are in really, if there's a normal anymore, we've returned to normal as far as athletics goes, fine arts, that sort of thing. We did hold camps and things this summer, but no mask requirement at that time.
That's right. Our high school students were doing extracurriculars. They were doing some of what we call credit recovery. They were doing some programs at the high school. It was not as detailed and as formal as the summer school program.
Okay. So that is a reflection of where we have been over this time period, and now we are preparing to start this next school year. And the CDC has issued new guidelines. There is a lot of discussion about that out in our community. Looking at the guidelines, talk about the guidelines and what we've been looking at.
Well, as we record this on August 3rd, about a week ago, there were a lot of news reports about the CDC changing their guidelines. They actually haven't updated the school guidelines per se, but they did announce an adjustment to those school guidelines that were put in place earlier in the summer. And that adjustment was they were recommending masks for anyone who was in a school as opposed to just those who were unvaccinated. On July 9th, the CDC issued guidance for return to school that included that bit of recommendation for those who were unvaccinated. And that is a distinct change from what we saw through the end of the last school year. The last school year, even through May, they very clearly recommended that schools require masks. Now they made that adjustment to recommend masks, and they also actually made a significant adjustment. In addition to simply recommending masks now, they talked about local conditions in their new guidance. And that CDC guidance, if you printed it out, it's about 16 pages. And so one of the key things we delved deeply into when we started looking about return to school was the detail of the CDC guidance. And that CDC guidance included recommendations. And they talk about a layered approach with mitigation strategies. And they walk through many mitigation strategies. And mask and a recommendation for a mask, as opposed to what they did in the past of required, was part of those mitigation strategies.
Okay. Let's talk about mitigation strategies, because I know that we have a great deal of them that we have internally, but let's share some of those. The first would be, if you're sick, stay home.
Well, for us, that's key. Do not come to school if you're sick. And you think back to how things were pre-COVID, if somebody had congestion, sniffles, a little bit of a cough, often you'd push it and come to school. Mm-hmm. We emphasized that last year, don't come to school if you're sick. I want to re-emphasize that this year. That is a key point. If you're sick, don't come to school. So many of us have heard over and over again the COVID symptoms. Mm-hmm. Fever, cough, illness, headache, congestion, those kinds of symptoms, don't come to school if you're sick. That is just as important now as it was last year. Don't come to school if you're sick.
Let's talk about, that's for any for anything, like you said. But let's talk about social distancing, because those guidelines continued to evolve and change over the year. Where are we with social distancing as we start back to school?
Another mitigation strategy in the new CDC guidelines includes social distancing, as you say. That has evolved in that a year plus ago, the social distancing description was 6 feet or more. Months ago, they changed that recommendation to 3 feet or more. One of the things we focused on at the beginning of last year was it was impossible in almost every classroom to be 6 feet or more apart for every student. You basically have to cut the class in half and separate them out. We actually tried that at the elementary level. Later on, the CDC, after more research, adjusted that to 3 feet. In many of our classes, students are 3 feet apart over the course of school. So that is a key mitigation strategy for us this coming year. When possible, if at all possible, keep students 3 feet apart from each other in class. And in many of our classes, we will be able to maintain that as one of our layered protocols. I will also say that the CDC guidelines mention that if you cannot maintain that 3 feet distancing, create cohorts, smaller groups that are around each other. If you can't be 3 feet, limit the groups. That actually often happens in some of our classes where students might sit at a table with 2 or 3 other students and be significantly further than 3 feet away from some of their peers. So we will be and are overlaying those mitigation strategies of whenever possible be 3+ feet apart, and when that's not possible, promote cohort groups where they stay together.
Okay. Also, another strategy is wearing a mask. And we've had many discussions over the verbiage in the CDC guidelines, recommended, required, but really they just say recommended.
Well, and it's tough when you think about the CDC guidelines to watch a quick news report. And the reality is, even in our discussion, there are going to be pieces of that are missing because we're not going to read 16 pages worth of discussion in guideline. But one of the elements that they do include is a recommendation of masks. And they also say consider local conditions. And some of those local conditions that are mentioned are the extent of the vaccine in the community, positive cases in the community, impact on children in the community, examples like that. And so as we analyzed whether to require masks this coming year, knowing that the CDC made a significant adjustment from simply saying you need to require them to that we recommend those along with recommending a number of other mitigation strategies, we studied that in depth. We talked with local folks, local medical folks, and ultimately, as those who are watching this know, I believe they know, we are not requiring masks, but we are strongly recommending masks. The CDC guidelines even get into some depth of masks may be even more heartily recommended if you are extra close to each other compared to further apart. They differentiate outdoor from indoor, and that was discussed at some point in the middle of last year. They shifted to outdoor versus indoor. And so if you delve through the guidelines, it acknowledges that there are times and maybe times where masks may not be worn, but you need to balance those mitigation strategies. There's even some suggestions in those mitigation strategies, in addition to considering local conditions, to talk about if you're going to remove something, be careful, see the impact of a particular removal before you remove something else within that package of mitigation strategies. And so as we analyze that, as our health folks looked at it, as our safety staff examined that, as we looked at our experience from last year, ultimately we decided that the most appropriate thing as we start school this year, knowing our vaccination rate, knowing the prevalence of the virus, knowing the impact on our schools, the most appropriate thing is to recommend masks.
So parents, I believe some parents have a concern that if they send their child to school with a mask on, that there might be bullying, if you will, for lack of a better term, or just making fun or of a student who might be wearing a mask.
That's a real concern of ours. In addition to that concern, there's the concern of just inadvertence. Might somebody say, hey, take off your mask for a second because I'm going to take a photo. We are emphasizing and re-emphasizing to our faculty and staff that it is absolutely important to honor those who choose to wear a mask. I have an anticipation that many of our teachers in certain settings will wear a mask, and sometimes they might not. I think that's possible with some of our students. But we do know that many parents have a concern. In fact, I think all of us should continue to have a concern about this virus. And we are making it a point that we are going to support and honor those who choose to wear a mask all the time, any time, part of the time. We are encouraging it, we're strongly recommending it, especially in a school setting, especially as the CDC says, when you're super close, that within the 3 feet period, there's a lot of wisdom in that. At the same time, the CDC acknowledges that there are times where focusing on that scope of mitigation strategies is important. And I will tell you also, Carol, we're starting with recommending masks, strongly recommending them, encouraging masks. The reality is that may change. We don't know what the future holds with the pandemic, and that's trite, but it's true. We've talked about that for a year and a half. Many people were hoping that we were going to be done with the pandemic by now. It's just not the case, and so we have to still be careful. With that, I want everyone to know that we're going to continue to monitor this, especially in the context of masks, because our experience from requiring them to not requiring them over the summer to now recommending them is an ongoing adjustment. It's something we're going to continue to watch every single day.
Okay. We have a board policy on communicable diseases. So talk about what that board policy the expectations of the board policy.
Well, very clearly the board policy, which has been in place before COVID hit, says if someone has a communicable disease, they can't be at school. They can't be on campus. It's really that simple. The board policy has a little bit more detail than that, but it's important for everyone to know that if you have a communicable disease, you can't be on campus. From a nursing protocol standpoint, if we have symptoms, the nurse will require a student to wear a mask. They'll be at the nurse's office, they'll be checked. If there's evidence of a fever, some other symptoms, the parents will be called and the students will need to go. Because it is important for us to make sure that that first thing we mentioned in this, that if you're sick, don't be at school, is honored.
Also, something else that will probably look different this year, or we know it will look different this year, is quarantine. So address what parents can expect with quarantine this year.
Well, we've heard from the health department, and the health department is responsible for quarantine. And what we know from the health department, I'm actually going to look at a couple of my notes when I speak to this because I am speaking for the health department. We know that public health still has a responsibility to investigate positive COVID-19 cases. They get those reported from testers, medical doctors, some of the clinics that actually test. They still have that obligation to report positive cases to the health department. And they do the contact tracing. As I understand it, as we understand it right now from the health department, they will actually be making calls to the positive case and asking who you had close contact with. And what we know is typically in those interviews, they'll give the details about not just who were you in close contact with, but talk about who you were near and ask questions about that so that those professionals can make that determination. And then they will and are still making those quarantine decisions and telling those that if you didn't meet their standards for being socially distanced and you were in contact with a positive case, they will quarantine. We will honor those quarantines. If the health department says you need to be quarantined, you can't come to school campus either. And so that is still going on from the health department. I anticipate, knowing what we've experienced in the past year and a half, that there will still be some evolution at that level from the health department. For example, the CDC has a recommendation that if both individuals, both the positive case and the one who is exposed, are wearing masks in that 3 to 6 foot range, as I read it, that one who was exposed may not have to be quarantined. I suspect that the health department will make adjustments over the course of time based on that. But those decisions are the health department's, and when they make a decision that someone is quarantined, we will honor that for on-campus school purposes.
But let's be clear, we do not quarantine. The school district does not quarantine.
That's correct. We don't quarantine, the health department quarantines, but we will honor that. I will tell you, that was a big issue last year. We were able to stay on campus the majority of the year, and really our experience was the impact of quarantine was much more significant in that context than the impact of the positive cases and those individuals who actually had a positive case, because quarantine affected a lot of people. If you weren't vaccinated, you were within 6 feet during a lot of the year, then you were quarantined. And we had some quarantines that were even 100+ people. And we know, number one, for those who are vaccinated, we've learned from the health department that quarantine isn't going to impact us. At the elementary level last year, we were able to stay on campus about 90% of the time, which from all the discussions I've had with my peers, especially in suburban areas and in more urban areas, that was pretty incredible, even with the quarantine. At the elementary level, there were a lot fewer cases than we experienced at the upper grades. So we had a combination of fewer cases, the impact of quarantine, and we were able to get to 90+%. At the upper grades this year, we know that the vaccination numbers for our students, we know the age groups because we can track that. The numbers are going up for vaccinations. And so our anticipation is the impact of quarantine is still going to be felt, but from all the information we have from the health department and from what's going on in our community, that impact is going to be less this year.
I know you want our parents to know that if their child is quarantined, that we do have instructional plans in place to make sure they are continuing to receive their good education.
Thank you for that, Carol. We have tools that we developed last year. It includes, if you're quarantined and it makes sense in your particular class, particular grade level, we have Zoom where a student can listen in. Students can always make up work, but with these new tools, there are many courses, many parts of a school day where a student is going to be able to listen in and participate to mitigate some of that. I think that's a tool that we'll be using from now on. If the students are taking a test or if they're in a group project, maybe during a particular 45-minute segment, it doesn't make sense to sit there on Zoom if somebody's out. But many classes, they'll be able to do that.
And Schoology, we have Schoology and various other things.
Thank you for that. Schoology, where a student can get their assignments and work on it. That's right.
Okay, very good. You brought up vaccinations. Let's touch on that just a little bit. The vaccination rate in Williamson County is, I believe, still the highest in the state.
Well, Williamson County is the highest in the state as we record this. We're a few percentage points over 50% for our total population. And the most recent data I saw is we're well over 60% for the 12+ age group, those who can get the vaccine. We already mentioned that many of our staff, thousands of our staff members have been vaccinated. We also know that last year some of our staff members who had the positive case did affect students with quarantines. With many of our folks, the majority of our folks being vaccinated, that's going to have an impact as well because that will limit quarantine. One of the key mitigation strategies when you really read the CDC guidelines for school reopening is vaccinations. That's their number one. Governor Lee actually had a press conference yesterday. The main context of that conference was to talk about TCAP and the Tennessee Ready test results. But in the Q&A time, he specifically mentioned that the state is encouraging vaccines. And that is consistent with my reading of the CDC guidelines. That's a critical piece. That's actually what CDC first mentions in their guidelines for schools. So vaccinations are having that positive impact on us. We're number one in the state. That is a factor in our professionals' evaluation of that question of mask as one of the layered mitigation strategies.
Okay. Have I forgotten to, I'm sure there's something I have forgotten to ask you, but is there anything else you want our parents to know as we, on the health and wellness front, as we start this school year?
Well, I know there's a lot of fear out there, and we felt it too. I want everyone to know that we have a lot of good professionals working on this. This is a team effort. We are recommending masks, and I know some folks wish that we required it. Our experience based on last year, based on this summer, based on the CDC guidelines, based on what we've learned locally about vaccinations, about the hospitalizations, about the number of adults versus the number of children with positive cases, that whole package that we've studied for so long leads us to conclude that the most appropriate place to start is to recommend masks. We don't know how many folks will choose to wear masks, but we want those who do choose it to know that we're going to honor that, we're going to encourage it. There'll be nervous times this year. It will continue to be a nervous time for many families. But as Governor Lee and the Commissioner of Education had that press conference just yesterday, based on our recording, to discuss TCAP, we will have that accountability this year. Another key item that the CDC mentions is the importance of having students on campus. And it's been nice to see that they added that this summer to acknowledge that. We learned that over a year ago, and we've made it a point to do that. With masks, we know that we've had a number of exemptions. We experienced that process of enforcing the mask requirement last year in a time where there was no vaccine. And we've got experience with all that. And if we determine with our professionals and consulting with what's going on locally, determine that we need to have masks, then I will take that to the board. At this stage...
You cannot make that decision on your own, is that correct?
That's correct. That actually has to be a board decision as we sit here today. And given everything we know, I'm not recommending that at this time. But again, we're going to watch this on a daily basis and keep an eye on where the progress goes with all those factors.
Okay. Well, thank you, and we will continue to communicate information as needed to our families, and so will our school principals as well. And of course, if families have any concerns, they do need to go to the school level and talk to their principal, their school nurse, correct?
Yes, and you actually triggered another thought. We actually will have masks available for anyone who wants masks. Again, we're encouraging it. Not requiring it, but encouraging it. Speak with your principal. I know there are students who have immune issues, some health issues, consulting with doctors. We work with families individually. Often we say consult with your doctor, and we talk with students' doctors and have those conversations when appropriate to make sure that we do what we can to meet a particular student's needs.
Okay. Thank you very much.
Yes, ma'am.
All right. And thank you for joining us for the Superintendent's Report.